off by saying I'm not a pharmacist. We do have a pharmacist on our coalition, Jeff Messina, who would have loved to have done this today, but Jeff has pulled in many directions, and he provides a lot to the community, and he's certainly been a real asset to our coalition. So I'm going to go over medications. Dr. Baker talked about medications, so I can kind of skip that point, some of those points, but this really is a tremendous issue. And I think I'm not saying anything that you don't already know or have been told today. We'll skip that. So take a look at this. I'll let you read this. So people over the age of 65 consume 30% of all prescriptions in the US and 40% of all over-the-counter medications, while they only represent 15% of the US population. So this is a real issue. So why is medication such a risk factor? Why is it one of the leading causes of falls as we age? Again, things that aren't, anything new to all of you. Chronic disease. As we age, of course, for many of us, we end up with heart disease, lung disease, could be diabetes. Some people may not have just one chronic disease. They may have a few chronic diseases, and of course they require different medications. And you go to different specialists for those. And then you end up with polypharmacy. And if you, like my mother was, if Dr. Oz recommended something, then you got that too. She was sending my father to the store like every other day. Dr. Oz said this, Dr. Oz said that. Great. Complicated medication schedules. This, especially for those of us who are nurses, we know how difficult that can be, especially when you start getting into eye drops and then inhalers where you've got to wait 5 minutes between. And one of the things I've learned as with some of our older folks is they take you literally. I have a good friend that would come to dinner, older gentleman, and at 8 o'clock he'd say, I gotta go. Why do you have to leave? Gotta take my medications. Why do you, doctor told me 8 o'clock. No, that's what they put on the discharge summary from the hospital. So if nothing else, try to get the word out to your friends and family that is just an arbitrary schedule that's given. It's important to space things out. But this poor guy, his whole life revolved around getting home to get that patch off, getting home to get that pill. Multiple prescribers, as Dr. Baker talked about. Even at my age now, I'm going to different specialists. And I just pulled this out of my wallet, I'm embarrassed to say, because the last time I went to the cardiologist and they asked me what medications now I'm a nurse, 42 years. What do you think I said? The green pill. And she said, aren't you a nurse? I went, yeah. Don't you know what I'm talking about? The little green pill. So I now carry one of these. I'm not too proud to say, here, we should have these. Dr. Baker talked about shopping for deals. We see this all the time. I see this with my own family. There'll be a deal, Walmart is better for some things, CVS is better for other things. And again, Dr. Baker explained, it's important for one pharmacist to be overseeing and making those recommendations that, this one really isn't good to take with this particular pill. Dr. Baker talked about that it's rare to see clinical trials in people over the age of 75. It just hasn't happened. So there isn't a lot of literature out there when it comes to how medications affect, especially some of the newer medications coming out. And hopefully we'll begin to see that there's more clinical trials. A lot of adverse drug side effects for any age. But then you couple on top of it with all the issues that can occur as we age, the side effects can sometimes intensify. The cascade effect. You take the medication for one thing, it causes a problem. Example, person has arthritic pain, they go on a non-steroidal pain pill, maybe Motrin or something. They end up with swollen ankles, they go to the doctor takes their blood pressure, it's up a little bit, oh, let's put you on a water pill. Problem is then the person doesn't want to drink because they're always having to go to the bathroom. So then they become dehydrated. I mean, it cascades. One thing leads to another, so you have to be very careful with that. Also, I was surprised to see, but I guess I shouldn't be, that almost 40% of seniors are unable to read prescription labels for a lot of different reasons. Small print, sometimes illiteracy. We've got a lot of folks where English is a second language, vision problems, just reading the label, and 67% are unable to understand information given to them. It's really a good thing to sort of, especially when you're out talking to folks, to really recommend as they age that they really should take somebody with them to the doctor. You know, it got to the point where I really had to go to the doctor with my family members because when they'd come home and I'd say, how would it go? What did they say? I don't know. They gave me this pill. But what did they say? I don't remember. And then just in general, you know, as we age, we've certainly been through a lot of discussion on that today, that alone is a risk factor. Doesn't that sound terrible? Yep, I'm up there. So these are some of the conditions. Now, when we talk about medications, we're not expecting you to go out and ask the folks what their medications are. What we are asking is that you're going to ask them, are they taking 4 or more, and explain, you know, why that can be an issue. It may come up in discussion what some of their issues are. The first time I did it and went out to talk to somebody, for the first half hour, 45 minutes, didn't share much, but then it came out little by little, the medical issues, and then the second hour came out the medications, then we go into the kitchen and out comes the bottles. You know, most of you that are going to be doing these home evaluations are not medical personnel. We don't expect you to do that. But keep in mind that if the person shares with you that they have Parkinson's, then know that the medications they're going to take for Parkinson's have the potential to have a lot of side effects and can cause dizziness, poor balance on top of their Parkinson's. So these are just sort of the conditions listed where the medications, in addition to their conditions, can create issues. So medications are absorbed into the body, usually via the intestine, and then distributed into the body via the bloodstream, and then metabolized or chemically changed, often in the liver, and then eliminated from the body, as Dr. Baker said, usually through urine and sometimes through bowel movements. Well, as we age, everything slows down. And so this really can affect how everything's distributed in the body, how it's metabolized, and how it's excreted. And so, don't you love the effects of aging on medications? I love this one, increase in percentage of body fat. I have a good reason why I have body fat, because I'm aging. So you can even be not weigh a lot, but you're going to have more body fat, simply because that's part of aging. So I have a good excuse. That's my excuse. The problem is some of the medications are fat soluble. So if you're on maybe Lipitor, fat soluble, that means that it's going to stay longer in there. And so after a while you can build up more and more, which can lead to side effects. Decrease in body water. Dr. Baker talked about that this morning. We have a lot of water-soluble medications. Same thing. Those medications are going to be ending up not leaving your body like they should. So one of the things that geriatricians are really trying to get across to general practitioners is to really pay attention to water-soluble and fat-soluble medications. And when they're prescribing medications to somebody who's older, to think about the benefits versus the risks. Again, this isn't something I expect you to go out and talk to everybody about, but for your own sake and your family's, just things to keep in mind. Everything slows down as we age. So there's decreased stomach, liver, and kidney function. You couple that with a person maybe has decreased, you're going to have decreased kidney function as you age, but maybe the person has kidney disease. Maybe the person's an alcoholic and has poor liver function. All of those things are going to affect the medications, and they're going to end up lasting longer in your body and become more toxic. And of course, decrease in memory. Don't remember to take the pills or take too many. I got a call one night from my father. My mother was on methadone for pain. She forgot she already took her methadone and double dosed her methadone. So this is something why we really advocate for pill boxes, so people can remember. They can just look at the pill box and know that they took it. And decrease in vision and hearing. These all impact how we take our medications. I put in your packets in the back, there's sort of a list of the medications that can be, the back of the this presentation. So it's a little bit easier to read. But the bottom line is blood pressure medicines, if the person says they're on a blood pressure medicine, then definitely you want to talk to them. In general, you should anyways, how important it is that when they get up from laying flat, that they dangle at the edge of the bed and let things kind of stabilize before they stand up. As we age, things are not as elastic. It takes a little bit longer for that blood to get everywhere. So it's a good thing to teach everybody that, but especially if they're on blood pressure medicine. That's actually been cited in research as probably a leading cause of falls for folks because their blood pressure drops. This is kind of hard to read. Antidepressants, you know, to be honest, you know, pretty much every medication has some side effect that can cause dizziness, can cause dehydration, all of the things that can lead to falls. But the other thing that people may not be aware of is that you need to be very careful with some of the over-the-counter sleep aids, antihistamines, and cough syrups. These have the ability to cause, if you take them too often, to cause some cognitive decline. In fact, studies have shown that if you take Benadryl, and you've taken Benadryl, which for many years people did for sleep, you take it every day, or just about every day for 3 years, your chances of dementia are pretty great. So these are anticholinergics that we have to be very careful with because they have the ability to decrease cognition and to cause sort of a downward spiral. So we need to be very careful. Again, people don't think of over-the-counter medications as being detrimental, but they can. A lot of the medications have these effects. Sedate, you see this with pain medications. They, of course, sedate you. Anti-anxiety medications, sometimes antidepressants. Dr. Baker talked at great length about orthostatic blood pressures, lying, sitting, standing. That's probably, she feels that's probably one of the most important things you can do to see if the person's at risk for falls, because a lot of times medications will cause that person to have a significant drop. And all it is that they have to readjust their medications. Sometimes there'll be certain medications that will cause the person to have Parkinsonian type symptoms, the shuffling gait, things like that. Visual impairment. She talked about insulins and medications for diabetes. They lower your blood sugar. They might lower it to the point that you're kind of out of it. If you've ever known anybody with diabetes, when their blood sugar drops suddenly, that becomes an emergency. They need to get carbohydrate into them. Otherwise, if nothing happens, death can ensue because they'll be going to become very dizzy, disoriented, and they will fall. Again, antihypertensive. 70% of seniors over the age of 70 are on blood pressure medicines. And what's interesting is that, you know, for years we said 120 over 80, everybody should be 120 over 80. Last year they came out and said no, that people 80 years and up really should be, you know, should be under 150 over 80. Now, if the person's always had a low blood pressure, that's one thing. But if the person, you know, all of a sudden is put on a blood pressure medicine and is telling you they're feeling dizzy, their balance is off, chances are that blood pressure medicine is too much, and we really don't want their blood pressure that low. And if somebody's under the age of 79, we'd like their blood pressure under 140 over 90. So that's a change that we've seen over the since last year. And I'm surprised Dr. Baker didn't talk about it. I'm pretty sure Dr. Tonetti out of Yale, they did a big study on antihypertensives. And 30 to 40% of folks that are on antihypertensives are more likely to suffer serious injuries from falls. She talked about deaths due to falls. They are up nationwide, just not even just Connecticut. In the last year, they've risen 64% in men, 84% in women. The major reasons for that is better coding. So with medical records, we know that was what caused the death, was a fall. But a lot of it has to do with the anticoagulants, the blood thinners, and especially with some of the newer blood thinners that are out there that don't require you to have your blood tested as often like you do on Coumadin. And so Coumadin, you have to go in and have an INR tested to make sure that your levels aren't too high or too low. But with the newer ones like Xarelto, the beauty of it is that you don't have to go get tested. However, what they don't tell you that's in small print is that if you end up, let's say, falling and you have a bleed, they can't give you vitamin K to counteract it like they do with Coumadin. There isn't a lot they can do for it. So unfortunately, if a person is on the newer anticoagulants and fall, they're going to end up with some pretty nasty internal bleeds, which oftentimes can lead to death. And then, of course, we see older folks living longer, and they're, many times when they live longer, they tend to be a little more frail. So we do see that's part of the reason, too, that we see an increase in deaths. So one of the things that we're going to do when we go out, and it's in your packet in the back, is we're going to be doing a personal fall assessment. And really, I'm just showing you the portion that talks about, the first thing they ask is, have you had any falls in the last 6 months? Most people don't share that with their doctor, their medical provider. I bet if you were to ask them that, and you should, if they say, yeah, I fell 2 months ago. Did you tell your doctor? No, I was fine, I got up. These are things they need to be sharing so they can sort of figure out what's going on, especially if they fall often. But then the next question is, do you take 4 or more medications? We're not asking them what do you take, but do you take 4 or more? And in the assessment, so we have it set up that you give them an assessment that they can keep, and you can ask these questions, and if there's information there for a little education for them on the side what to do, but you don't have to dig deep. If they want to share it with you, that's great. But if they don't want to, at least they have that information and know that at some point they should follow up. We're also going to be doing the blood pressure when we go in. Now, not everybody going out is going to be a nurse or an EMT. We have a lot of EMTs in our Medical Reserve Corps. So we certainly have the blood pressure cuff and stethoscope for those who would like it, but we also have this nice machine. And we also have cuffs for larger arms. And this came highly recommended by physicians. So we'll be using this and we'll keep it calibrated. So, ideally what we would love is for you to explain that blood pressures, really, sometimes they don't even know what their blood pressure is. Maybe it's not checked that often. So this is a great opportunity. So maybe when we take a tour, you might be willing to lay down and we can take your blood pressure and then have you sit at the edge of the bed, and then we can give you these numbers to give to your doctor. And if we see a real drop, definitely you want to talk to your doctor. It's also a great way for you to see how do they get out of their bed. Especially as Lori was talking about with the pillow tops. My gentleman just about slid out of the bed as he sat on the edge of the bed. And he said, oh, I do that all the time. It's no big deal. So anyways, this is what we'll be sending out in the bag. So these are recommendations that we have. So in the back of your book is a resource guide that's on our website, and this is really a collaborative effort of the coalition. And then Dr. Baker sort of went through it, and we removed things that were not evidence-based. And we are actually going to give that resource guide to the people. That's one of the first things you're going to provide them, is with a folder that's going to have this information in there. And so as as subjects come up, you can refer to that if you want. Or you can say, please be sure to read through it. But, you know, some of the points, read through it yourself, and so that you have a little bit of a background, and you can say to them, you know, and we do ask the questions. We're going to go through it shortly, but we do ask, do they, you know, how do they know to take their medications? Do they use a med box or something like that? So first of all, get across to them to carry that list, just like Maria said. They were ready yesterday, but we didn't get there in time to pick them up. We actually have medication cards that we've done up that are along the same line of the one that I showed you. It opens up. So that's something that we're going to have you provide to them, and really encourage them to have it up to date and carry it with them in their wallet, so they're not talking about the color of the pills when they go to the doctor or go to the hospital. Talk to them about the importance of reviewing their medications with their doctor or going to the pharmacy, and to read those labels and to read the information. Everybody gets the inserts now with all that information, and it's always incredible how many people don't read it. And then you have other people that read it to the point that they kind of go overboard. Where if they're taking Coumadin, they know they're not supposed to have green leafy vegetables, so they never, ever, ever eat a green leafy vegetable ever again. So we go from extreme to extreme. Use a medication box as a reminder. We will have some of these in the bag. And ask them, do they have one? And if not, provide them with one. Remind them the importance of staying hydrated. You know, one of the things that I've learned, and I know a lot of you probably know this, especially nurses, especially for women as we get older, we don't want to drink as much because it means we have to go to the bathroom. And what people don't realize is that you really will go less to the bathroom and not piddle as much if you drink more. Your bladder gets kind of irritated when it's not filled. So that's why it wants to empty itself more often if you're dehydrated and don't have a lot in that bladder. So it's kind of counterintuitive. So the more you drink, the less you're going to have to go and piddle. You won't go as often. And I'm sure some of you figured that out on your own. So when they say to you, no, I don't want to drink because then I have to go to the bathroom and it hurts to get down on the toilet. These are things that, write down, let us know when you come back and we talk so that we can talk to them about these things. Also, too, we have a lot of folks that drink nothing but tea and coffee. And those have caffeine, and they're very dehydrating. I know people that have ended up in the hospital with dehydration and will argue, I drink all the time. Yeah, I drink coffee all day, but that's caffeinated, and that ends up being a diuretic. Ask them to talk to their healthcare provider about vitamin D. Studies have shown that as we age, we should be taking about 800 milligrams to 1,000 milligrams of vitamin D every day, and it will help with lower body strength, which will help with muscle strength, which will help with balance. And so now the studies are showing that, as we age, we should be on vitamin D and calcium. But again, something to talk about with your provider. Talk to them again about dangling their feet, not hopping out of bed, or when they get up from a chair, to stand there before they just take off. Let their body acclimate, let the blood flow, get everywhere before they head off. They need to talk to their healthcare provider if they're having trouble taking the medications. Is the pill too big? Is it leaving an acid feeling? Is it making them feel nauseated? I can remember years ago as a little kid visiting my great-grandmother, and my grandmother would get after her, Ma, you got to take your pills. And we discovered when we looked at her pills that she was, but what we didn't know is she was going over to the sink, putting it in her mouth and spitting it out. So, she took her pills, spit it out. But anyways, she didn't like it. She didn't think she needed it. So, it may all be well and good that they have their pill bottles, but are they in fact taking them? And sometimes people too, sometimes the co-pays end up being expensive, so they want to space out their medications. So again, talk to them about the importance of talking to their pharmacist, talking to their doctor. My father, God bless him, I just can't believe some of the things he's done lately. He has gone to the pharmacist, took his list of medications and said, these are too expensive. What can I have that's less expensive will do the same trick? He then took that list to his doctor and got new prescriptions. So, there are things that we can do. It's just oftentimes the doctor just writes what he's used to writing. So, you need to be an advocate for your family and friends and for yourself. Discard medications at local drug collection boxes. We know that there's a real issue out there with drug use among, all ages, especially younger folks that are getting into family prescriptions. So when they're no longer needed, in this area, except for East Lyme, the police stations have drop boxes where you can take the medications and put them in, and they're safely discarded. And then really emphasize to them that they have to talk to their healthcare provider if they're having dizziness, if they feel like they're going to fall, if they have fallen. Too often, people don't, like I said, don't share that.